Learning Continuity Plan for School Year 2020-2021. Ilihan Elementary School is guided with the DepEd mission, vision, core values, and division quality policy. Learning Continuity Plan is a school's strategic plan addressing the challenges in the basic education which will be in effect by the time of pandemic brought about by unforeseen public health crisis in school year 2020-2021. LCP of Ilihan Elementary School was conceptualized by the school head with the end view of providing comprehensive plan which is intended to be used this school year. There is no one-size-fits-all solution and instruction to this situation. The choice and contextualization of the learning delivery will actually depend on local situation and access to learning platforms in the school. The goal of the school in the preparation of Learning Continuity Plan. The objectives of the LCP as a response to address the challenges in the basic education in the new normal. The LCP cycle in the operationalization of the activities to attain goals and objectives. The data in the tables, graphs, and infographics are the results of surveys through remote and face-to-face enrollment. This information reflects the school context along local situation. There are 17 learners or 3.59% added to the present total enrollment. Some of the learners transferred to other public schools due to some valid reasons, while the other transferees came from the private schools. The present enrollment of SPED decreased of 2 or 14% due to COVID-19. The parents decided to transfer them into their hometown, but the teacher will always conduct follow-up if these children continue their schooling. The total number of teachers in the school year 2019-2020 is more than the present school year. After the thorough teacher-learner ratio analysis, we determined that we have one excess teacher. The school maintains its medium-sized category. The enrollment increases with a very minimal number of learners as compared to the previous school year, which was done in different platforms of enrollment due to health crises such as online, offline, face-to-face, and other forms of remote enrollment. Majority of the learners preferred the modular printed with 73.88% or 362 out of 490 learners. 72% or 353 out of 490 learners have unstable internet connection in the locality for their studies, and aside, they don't have enough load to access the internet. Online distance learning will not possible at this time for learners. 38% or 187 of learners' fathers are full-time in their jobs. Others are self-employed and part-timers to earn income for the family. 44% or 215 of mothers are not working and staying at home. Family employment status affect the child's learning process. Majority or 48% of the parents or guardians finished secondary education, 25% completed elementary, and 20% went to college. It reveals that parents or guardians have the ability to teach and supervise their children in learning at home. 44 families are recipients of Pantawid Pamilyang Pilipino program, while most of them are not recipient and depend only on their family income. Almost learners belong to household with 0 to 3 K to 6 learners, wherein parents can give their full support to the education of their siblings. Most of them have available devices at home that a learner can use for learning. Learners and parents can have open communication using call and text messaging during the learning process of their children. Most of the learners can connect their gadgets to internet through their own mobile data, while the others have no source to have an access to internet. Some learners can go to other places to have internet access. Online distance learning will not be possible unless there are providers who can install more accessible signal to connect the internet. ICLEA Framework of Region 4A Calabarzon. The school determines the learning modality preferences of the learner or parent through the activities and surveys conducted to end at the final preferences of the learners or the parents. The Decision 3 helps us identify the learning modality which best fits in our school based on the consolidated data from the surveys. Modular distance learning modality will be offered by the school per grade level. Only modular distance learning will be offered in all grade levels including the SPED. The process flow for modular distance learning or MDL. Assessment of learning outcomes will be assessed by the teachers using the modular distance learning platform. The K-12 Curriculum Assessment DepEd Order No. 8 Series 2015 will be the teachers' guidelines in the assessment of the competencies in all grade levels. There are 18 classes from kinder to grade 6 including the SPED with 18 teachers for a total of 490 learners. Number of teachers is enough to the enrollment by grade level. Teachers need to enhance their competencies through online LEC sessions or insets to adjust their instructions fitted to the new normal setting of education. A school plan for Learning Action Cell to address teachers' needs on teaching learning process, on the approaches and strategies on different learning modalities will be of great help for them because it will be the best intervention to improve instruction for the new normal setting. A school head will assist and assess teachers' strengths and needs, as well as their best practices for benchmarking of other teachers. Technical assistance will also be provided, using appreciative inquiry to motivate teachers improve their competencies. A school prepared a specific plan in case of face-to-face learning is allowed. Majority of our learners are from Sitio Hulong Silangan, followed by Hulong Bayanan, and the least are residing outside the barangay. Only modular distance learning will be offered in all grade levels, including the SPED. Status of prepared idea learning exemplars of teachers. Before the opening of classes, teachers had already prepared their exemplars for quarter 1 and still preparing the second quarter exemplars. Schools have sufficient number of learners materials except MAPE 1 and AP 6. Available printed modules will reproduce sufficiently for the total number of learners from grades 1 to 6. Proposed interventions to address the possible problems that may be met by the learners are identified. Topics will help teachers address the needs for instruction. Coaching and mentoring will also be conducted by the school head. Teachers need to capacitate the transition of teaching modalities in the new normal to enhance teaching learning instructions. Competencies are selected from the K-12 curriculum to the most essential competencies and the enabling objectives to be taught as prerequisite skills. Every phase of the lesson, learner will be able to learn the skills being developed as stated in the MELCs. Main focus of the implementation of learning competencies to be learned by the learners in every grade level considered the health and safety of all persons involved in teaching in time of this health crisis. Teachers must adjust and apply appropriate instructions for the best learning of learners in the new setting of learning at home. It is better for the school leader to assist the teachers first for gradual transition of teaching during this time of pandemic. Process flow of instructional supervision to be conducted by the school head, PSDS, EPS VRs, and master teachers in modular distance learning. A school head ensures that the learners are treated fairly, and the progress must be reported to parents and stakeholders regularly. Available ICT resources in school can help in teaching learning process. It will help in the instruction once face-to-face learning conducts in school. A school does not designate other centers because barangay hall is situated near the school and school is more accessible to transport the materials. A school encourages stakeholders to gain their full support in education in the new setting. Stakeholders want to make us free from the threat of health crisis in our country. School and volunteer groups commit to support by signing in the Memorandum of Agreement. School previous plans for the year have been adjusted to cope the emergency necessary expenses brought about by health crisis.